Before we get started setting up our system defaults and collections work list, we need to identify what office key we want to set this up at. If you have a central billing office key, you may decide to set your collections module up at the CBO level, or you can do it at the individual office key level. However, you cannot do it in both CBO and individual office keys. You have to make a decision whether you want it in your central billing office versus your individual office keys. To identify where we want to set up the collections module, let's go through these questions. 1, you first have to have a central billing office key in order to set up your collections from that level. 2, you need to be comfortable with only sorting options such as collector, balance due, days past due, and responsible party. You do not get the options of filtering your collections work list by carrier category, provider, carriers, financial classes, and such. And 3, you need to be comfortable working all of your office key patients in the same work list. This is how your work list will look when you're setting it up at the central billing office level. You get your name, you get your collector, you can choose a balance, and you can choose days past due and responsible party. But your filter selections are completely grayed out and you are prevented from using any of them. So if you're okay with setting up your collections module with only these collection worklist options, then you may want to do it from this level. If you do decide to set up your collections worklist at the central billing office level, make sure that when you do all of your setup, you do it from the CBO level itself. And of course, if you have a central billing office, you will recalculate your collections worklist from the CBO, even if it's set up at the individual office key. So anytime you do change or modify your worklist, you'll log into your central billing office key and recalculate your collections worklist.